When we're studying muscles, it's sometimes helpful to look at the muscles in the context of a functional group. And we're going to look at the four muscles of the rotator cuff as an example in the upper appendicular skeleton. Here we can see the left scapula and humerus. All four muscles of the rotator cuff have related actions in that they move the humerus in some way. They all originate here on the scapula. They cross over this joint called the glenohumeral joint and insert on the tubercles of the humerus. The glenohumeral joint here is a synovial ball and socket joint, so there's a great range of motion here. But the glenoid cavity of the scapula is rather shallow, so the rotator cuff muscles also play a very important role in stabilizing this joint. If we look at the posterior surface of the upper back, we first see these superficial muscles that are not part of the rotator cuff. Here we can see the trapezius muscle and the deltoid muscle. And in order to see the muscles of the rotator cuff, we first need to remove these superficial muscles. So if we remove these superficial muscles, we can see the deeper muscles of the rotator cuff. On the posterior surface, we can see three of the four rotator cuff muscles, and these are from the most superior to the most inferior. The supraspinatus muscle, which is highlighted here in purple, the infraspinatus muscle, also highlighted in purple, and finally we can see the teres minor muscle. So let's first take a look at the supraspinatus muscle. This muscle is named because it sits just above the spine of the scapula here. And if we take a closer look, we can see that this muscle originates here in what's called the supraspinous fossa, a depression just superior to the spine of the scapula. It tucks underneath the acromion process and inserts here on the greater tubercle of the humerus. Let's talk about the action of the supraspinatus muscle. If you contract this muscle and shorten it, what do you think is going to happen to the humerus? Well, the action of the supraspinatus muscle is that it's going to move the humerus in this direction, away from the midline of the body. And if you remember, we call that abduction. AB. Abduction of the humerus. So let's take a look at a quick video showing this action. Here we can see abduction of the humerus, and that's the action of the supraspinatus muscle. Okay, so back to the posterior muscles of the rotator cuff. Just inferior to the supraspinatus muscle, you can see the infraspinatus muscle, highlighted in purple. This muscle is named because it sits just below the spine of the scapula. And in your cat, you can really feel that spine between the supra and infraspinatus muscles. So if we take a closer look here, we can see that let's take it down even further. We can see that the infraspinatus muscle originates here on the infraspinous fossa and inserts also on the greater tubercle of the humerus. So what do you think the action of the infraspinatus muscle is? Think about if you contracted this muscle and made it shorter, what would happen to the humerus? Well, the action of the infraspinatus muscle is to move the humerus in this direction, towards the midline of the body. And if you remember, we call that adduction. AD, adduction of the humerus. The other important action of the infraspinatus muscle is lateral rotation of the humerus. So let's take a look at the action of lateral rotation. So this video shows lateral rotation of the humerus. It's rotating the humerus as it moves laterally, and it's also called external rotation. And this is the action of the infraspinatus muscle. Back to the rotator cuff muscles. The most inferior of the rotator cuff muscles on the posterior side is the teres minor. This muscle originates on the lateral border of the scapula and also inserts on the greater tubercle of the humerus. The actions of the teres minor are very similar to the infraspinatus in that it adducts and laterally rotates the humerus. To see the fourth muscle of the rotator cuff group, we need to flip over to the anterior side. And again, we can see superficial muscles first. Here's the pectoralis major and also the deltoid muscle. We take this a little bit deeper. We can see the next layer shows us the pectoralis minor muscle. And we have to take it even one layer deeper in order to see the subscapularis muscle. And that's the muscle that's part of the rotator cuff, and it's highlighted here in purple. Let's remove all this ink, and here we can see the subscapularis muscle. So if we think about the scapula as lying on your back, this muscle is going to be underneath the scapula, so we call it the subscapularis muscle. It originates in a depression, a sort of concave depression here, called the subscapular fossa, and it inserts just about here in what's called the lesser tubercle of the humerus. So again, let's think about action. If you shorten this muscle, okay, and contracted this muscle, what do you think would happen to the movement at the humerus? While the infraspinatus and the teres minor muscle laterally rotate the humerus, the subscapularis medially rotates the humerus. So let's take a quick look at a short video showing medial rotation. So this video shows medial rotation of the humerus, and this is the action of the subscapularis muscle. Let's summarize the muscles of the rotator cuff. On the posterior side, we have the supraspinatus, which abducts the humerus, and then the infraspinatus and the teres minor, which both adduct and laterally rotate the humerus. And on the anterior side, we have the subscapularis, which medially rotates the humerus. So you can see how the anatomic locations and the actions of all four muscles in the group are related. You should be able to identify all four of these muscles on the human models in the lab this week. And in your CAT dissection, you should be able to identify the supra and infraspinatus muscles.